How do doctors accurately diagnose hypertension stages? Imagine trying to figure out if your blood pressure is high or just temporarily elevated. That's what doctors do to diagnose hypertension accurately. They don't rely on just one reading. Instead, they follow a careful process to get the real picture. First, they measure blood pressure using a cuff wrapped around your upper arm. This cuff inflates to temporarily stop blood flow and then slowly deflates, recording to numbers. The systolic pressure, which is the pressure in your arteries when your heart beats, and the diastolic pressure, the pressure between beats. To get a reliable diagnosis, doctors usually take multiple readings across different visits. They want to see if high readings are consistent or just a one-time thing caused by stress or recent activity. When measuring, they make sure you are seated quietly for at least 5 minutes and use the correct cuff size. If your blood pressure is high in the office, they might suggest home monitoring or 24-hour ambulatory blood pressure monitoring. These methods give a more complete picture because they record your blood pressure over a whole day, including during sleep. Home monitoring uses a device you can use yourself, and the thresholds for concern are slightly lower than in the office. For example, a blood pressure of 135/85 millimeters of mercury or higher at home might be a sign of hypertension. The 24-hour ambulatory monitor averages your blood pressure over the entire day and night. If the average is 130/80 or higher, it indicates hypertension. Once the readings are collected, doctors compare them to established guidelines. They look at the numbers to classify your blood pressure into different stages. Normal blood pressure is less than 120/80. Elevated blood pressure is when systolic is between 120 and 129, and diastolic stays below 80. Stage 1 hypertension is when systolic is between 130 and 139, or diastolic is between 80 and 89. Stage 2 hypertension is when systolic is 140 or higher, or diastolic is 90 or higher. Sometimes, a single very high reading, like 180/110, combined with signs of damage to your heart, kidneys, or eyes, might mean immediate treatment is needed. Doctors also check for masked hypertension, where office readings are normal but out-of-office readings are high. They do this with ambulatory or home monitoring. Besides blood pressure, doctors may perform physical exams and order blood or urine tests. These help find underlying causes or check for damage to organs affected by high blood pressure. They look for signs of strain on the heart, kidneys, brain, or eyes. This thorough process helps doctors make sure they diagnose hypertension correctly and determine its stage. Proper staging guides treatment choices and helps track how well your blood pressure responds to therapy. This careful approach makes sure you get the right care to reduce your risk of heart disease, stroke, and other health problems.